Aortic anastomosis. This exercise will review an aortic anastomosis in a hemiarch type configuration. This is the type of setting you might see in an aortic dissection. You'll notice we have the two grafts a little close to each other to get started. You'd usually have an assistant holding this one, and this would be the aorta itself. It is angled towards the sternal notch or towards the head of the patient. These do tend to be deep in the chest. Here we have it out a little bit for illustration, but this is roughly speaking how that sort of a clinical scenario might look. So we're going to review the type of needle angles that you use for an aortic graft anastomosis. So we'll start off with a backhand and a slight 45-degree angle, no tilt. And again, what I mean by tilt is this would be an outward tilt, and this would be an inward tilt towards me. This is a so-called hook shot. So there's no tilt. It's about 45 degrees. So the first thing you want to do before you start suturing this is know where your end points are. So this is about 3 o'clock. This is 6 o'clock. So similar to that, we're going to call this down here about 3 o'clock. No, sorry, 6 o'clock, and this one 3 o'clock. So let's start right at the side. And these bites aren't going to be too small. These are going to be a little more generous, maybe 4 or 5 millimeters. And I'm going to grab it with my pickups and let go immediately with the castros. You don't want to grab it and have your castro holding it, because you can tear on the graft or the vessel. Now I'm going to pull this up. Just enough so that I don't run out of suture. Really easy to get tangled, so you want to avoid that. I'm going to go right here to 3 o'clock. This would be out on the aorta itself. So the aorta, if you're going to grab it, you want it to be kind of full thickness. You don't want to peel off the intima, and you want to take a nice full thickness bite from the outside. And once you grab it, let go immediately with your castro. However long it takes, get the needle to come out smoothly, don't tear it. Now we can reload it anywhere, up on the top if we want. And again, it's just going to be a backhand. We'll pull this up. There are many different ways to do an aortic anastomosis. This is just one simple way which I use, but then also just helps demonstrate it. At this point, you kind of want to even out your sutures if you can, because you don't want to have too much on any one side. I think this will be roughly okay. So we're continuing down, traveling the same distance from the last stitch as I was from the edge. That's probably the most important thing about this exercise. So I'm looking at the back, and I see, okay, I traveled about 5 millimeters, so I want to move about 5 millimeters. This represents the back wall of the aorta. This is probably a site where it's very challenging to fix things on. Later, so you have to do it right now as you go. So again, I look at the last stitch, about 5 millimeters away. There are times when you have size differences between the graft and the aorta, and you have to make up that difference, but here we're pretty evenly sized. Now I'm getting close to, but not quite yet, at the bottom. So probably have one more stitch. The big key is your left hand. no question about it for these. Grabbing here, if I went right to my last stitch here, that would be way too much of a travel. So I'm going to look back here and probably go about it in between those two. Now I'm going to be right down at the bottom here. Sticking with my backhand, but at some point you can switch to forehand. I'm right at the bottom stitch there as well. There's a little divide between where the two edges were glued together, so I don't want to go right in the middle of that. I'm just going just off of that. Now I'm going to switch to my forehand. Now I'm kind of at a point where I have to release a little bit of slack on this and let this come forward to it. Do it like so. And I'm almost at the exact opposite to where I started there. And on this side, it's the same thing. I'm almost at the exact opposite to where I started. So I'm going to take it out on the graft. And now I got to pull these sutures and make them all even. It's very important to be able to do this, and it can be hard. Kind of start here with the ones that are loose. You can go to every other one. Even just doing this teaches you how to be careful and align your purling sutures well. It's better to do this here and now than learning it in the operating room for the first time. So there, so the back wall is reasonably even there, so that looks okay. So at this point I could continue a little bit more with the same stitch, which I think I might. Now you have to notice you are out on the graft, so if you went into out on the graft, you got to go out on the aorta. Now I'm pretty much directly opposite to where I started. These are forehand stitches. I'm still forehand. So I'm going to stop over here on this side. We're going to go ahead and release this tape, this band rather, off of the end of the graft to let the graft move freely. And I'm going to take the other stitch now. Usually these are going to be forehands. So you got to look inside and say, okay, where am I? So I'm inside on the graft. So I'm going to move this aorta out of the way, and I'm going to go inside on the aorta, inside out. About 5 millimeters away, 5 millimeters from the last stitch. Five millimeters from the edge, 5 millimeters from the last stitch. The edges aren't quite close enough to take them in one, but now it's getting a little bit closer. Notice that I'm switching my needle angle as I'm coming down, so I'm getting to this point where I'm sort of going up a hill here. So I keep switching it to a forward angle, so it's about a 30-degree angle forehand. The option is I can switch to backhand, or I can come up with the other stitch. I think we'll try to just switch here to backhand. I don't force it if it doesn't come in one, because you can really tear the tissue like that. You want to make sure it's a balance between keeping it snug and not letting your stitches be loose, and by the same token not having an assistant pull up so much that it tears it. And that's it. So we'll just sort of snug up on all the sides here a little bit, just to, this obviously you're not going to test these anastomoses by getting fluid through them. The key is just to observe that you're symmetric, evenly spaced. If you're evenly spaced, you almost guarantee that you're going to be hemostatic. And if you didn't cause tears on the tissue as you went along. So 2 knots in the same direction, one-handed, pulling up a little bit on my left hand and kind of supporting the knot with my right. And I'll do this one in the same direction. Now reversed, switch directions on the third one, and now you just tie the rest to get some security knots on top of those first 3. I always pull up on my left hand a bit to make sure the knot is secured. But I don't do that without having my finger on the knot. Eight throws for proline. And you're done. Now, just like with the coronaries, you should have a quick look at things from all sides. This looks fairly symmetrical. Towards the back, it looks reasonable. Always review your anastomosis at the end.